Okay, bud, let's do this again. We'll go through with the longer version and we'll try and hit some different drugs. A, allopurinol. That's for gout. Make sure you take it with a lot of water. And remember, with gout, stay away from tomatoes and beer, okay? B, let's do, how about baclofen? Baclofen is a muscle relaxant. You use it for muscle spasms. It can be used with certain things like MS too, but it can make you drowsy, so you got to watch out for that. C. How about C? Okay, let's do carvedilol. That's a beta blocker. It's used to lower your blood pressure, but it also mainly is used for people with things like heart failure or other issues like that. It can cause you to be dizzy and fatigued, so a multivitamin's a good idea. D. Okay. Let's do diclofenac. That comes as tablets or a gel, but with the tablets, you need to make sure you use them, take them with food because they can upset your stomach. And if you have heart issues, you need to talk to your doctor before you do that. E. Let's look. Okay. How about escitalopram? That's an antidepressant. 1 tablet once a day. Remember, it can take 6 to 8 weeks to see the full results with that one, okay? F. Okay. How about fenofibrate? That one's kind of a controversial one, okay? It comes as tablets and capsules, but it mainly lowers your triglycerides, and you can use it in combination with other drugs to keep your cholesterol low. G. Okay. How about glimepiride? That's a sulfonylurea. That's a big one. That's for diabetes, okay? Mainly type 2, okay? And it actually keeps a good level in your blood level, keeps it up to help control a little better than some of the other ones that they have. H. Oh, Grandpa used this a couple times today. Hydralazine. That one's for blood pressure, okay? And actually, in African Americans, it has better results than a lot of the other blood pressure medications. I. What are we going to do for I? I know we did ibuprofen last time. You know what? How about irbesartan? That's a cool name. That's generic Avapro. And it's for blood pressure. It's an ARB, angiotensin receptor blocker. J. You know what? One of Grandpa's favorites, Jardiance. It's used for diabetes. It also helps improve cardiac outcomes for people with heart failure or issues like that. It's expensive, but it's once a day, and it is a good drug. K. K's tough. There's really not a lot out there. There's just a couple. Yeah, we did this before, but Ketorolac. This one can upset your stomach. You got to take it with food, and you should only use it for 5 days at the most because it can be hard on your kidneys too. L. Okay. Let's see here. You know what? Levofloxacin. Big word. It's a fluoroquinolone, and it's an antibiotic. You use it once a day. You have to avoid the sun. Take it with a lot of water, and no dairy products within an hour before to 2 hours after. And you also want to watch out. Sometimes you can have trouble with your tendons with that one. M. What is a good M1? We did metformin the last time, but you know what? Okay. Meloxicam. That's a non-steroidal anti-inflammatory too. 15 milligrams is generally once a day or 7.5 twice a day. Take it with food. Oh boy, we got to go the other side now, buddy. You're getting a little bigger than the last time we did this. And, oh, you know what? Niacin. Niacin, they use it to help lower your cholesterol. It's kind of controversial again on that. But a hint with that one, it can cause flushing where you get red in your face. If that happens, you can take an aspirin a half hour before and it will help out. Oh boy. How about ondansetron, generic Zofran? It's used for nausea and vomiting. You need to drink a lot of water with it because you're dehydrated anyway, but it can cause a headache and make you dizzy. Yes. P. Oh boy. How about phenazeparidine? That one, use it. Women will use it when they have trouble going to the bathroom, going pee, because it burns. And this will take the burning away. But it changes the color of your tears and your urine to bright orange. So if you wear contacts, you got to be careful. Q. Oh, how about quinapril? That's another ACE inhibitor used for blood pressure. Remember, it can make you dizzy, could give you a dry cough, and it also raises your potassium, or can raise your potassium. R. Let's see here. Ropinirole. Yes, ropinirole is used for restless leg syndrome. It can also be used for Parkinson's. If you're using it for restless legs, they give it mainly at night, and it can make you a little bit dizzy when you start it, okay? S. All right. Let's do spironolactone. Oh, I know, that's a big word. That is a potassium-sparing diuretic. So it takes fluid away. So you really should try and take it earlier in the day so when you go to the bathroom, you're not up all night, okay? Now, T. We did one last time with tamsulosin, but that wasn't very good because you found out you had a prostate. So this time, let's do tizanidine. That's another muscle relaxant used for muscle spasms. It can make you drowsy, but you know what? Tizanidine doesn't make you as drowsy as other muscle relaxants. U. Oh boy. How about ursodiol? That's a big one. Yeah, those are big capsules too. This drug can actually help dissolve gallstones. And so people who have buildup of gallstones within their gallbladder can be on that to help prevent that. V. How about valcyclovir? That's an antiviral. Yep, take it with a lot of water. They can use that if you get shingles or the chicken pox. I like acyclovir better, but it's a good drug if you happen to get a cold sore. You can get on it for preventative reasons and take 2 grams twice a day at the onset of the cold sore. All right, W. You know what? Wegovy. It's actually in the fridge, but that one is called the GLP-1. It's the only one out there that's indicated for weight loss, and it's a once-a-week injection. Okay? Yeah. X. Not very many X's. But how about Xifaxan? That is an antibiotic, a very expensive one, used for IBS, but mainly for C. diff, Clostridium difficile. And people have terrible issues with that, with diarrhea. That can help out with a 6-week treatment. Why? Not very many Y's at all, bud. Really, there's a birth control called Yaz. And birth control is what gals take to help prevent from getting pregnant. Oh, I know. But with those, they need to remember to take it with vitamin B 6 to help prevent depression, okay? And we're to Z, all the way to Z. All right. Let's look at ziprasidone, okay? It's a capsule and it's an antipsychotic. It helps people that have mood disorders and psychosis. And with that one, it takes about 6 to 8 weeks to see the full results. Are you ready to go have something to eat? All right, we did it. A through Z. We'll have to do it again, okay? Let's